So that's the most important part of the homeopaths, not just for you, but for all of us, because that's where it all starts. If we are not able to see the sensation, or we are not able to allow the patient to experience his state, and then we are not able to recognize the state, it doesn't matter how much more you know. It doesn't matter what your materia medica is, your knowledge is, how many remedies you know, what good programs you have. You cannot find the simillimum. So that's really good, because that's something I do very well. Whether I know the remedy or not of the patient, at the end of a case, for sure, I know the sensation and experience, right? So that eases me off, that I only have this much to teach you. And that's what we will emphasize on, and that is how to bring the patient into his state, how to recognize that he is in his state, right? And how to objectify the data. So what you're saying is it's a talent. That makes it a very subjective thing. You know, it's like, I don't know how you can do it, maybe you can do it, maybe you cannot do it. It's not like that. There is definitive steps, 1, 2, 3, 4, that if you follow, you can go to the state of the patient. There's definite indications from the patient which tell you, I'm in my state now, right? And so therefore, we will emphasize that as we go on. Anything else? Any other points? This is very good, because I think we'll all probably feel the same in many cases, and it'll be good to emphasize that, right? And at the end of today, you have to tell me whether this question is cleared for you. And it is not an inborn talent. It is a learned talent, and we can all do it. And when you leave here, this workshop, you should be able to do it. Otherwise, you don't leave here. Okay. Okay? Just don't go. Just stay here. No, forever, till you get it. That's our job, right? So we have to pay for you to stay here to get it. To a specific, you know, you've kind of illustrated one more specific area, that yes, we understand what is state, and patients can go there, but sometimes they just go on and on and on, and we're not able to get them to move. We know they are not in their state, yeah, but we're not able to get them to move.
And you feel exhausted trying to do everything, dreams, fears, problem. You know, you just try to go everywhere. Yeah.
And they still don't
Yep.
go there.
Yeah.
Absolutely. So that's exactly.
Political thing there is very strong, that they are so suspicious.
So if I could generalize it,
Yeah.
this is a problem that you've taken this into, you've now taken that general thing of getting into the state, bringing another problem, and it's not unique to you, because you might think it is because of the political situation, but everywhere there are those people who are going to sit there and tell you, this is my symptom. Maybe they're okay to go into their emotion because they know mind-body connection and stress has a big part. But when you try to tell them, close your eyes, experience what's happening, and you can see them completely not ready to go there. Yes? So you feel it's because of the political situation and they are suspicious. We have these people all the time. So they walk in from their bank with the ties, the coats, their briefcases. They're looking at their Rolex watches. They have only an hour to spend with you. And they have blood pressure, they have diabetes, they have gallstones, and they have a block of 90% in one of their arteries. And you need to sort this out. And of course, they have a high pressure job, and you know that. It's a very stressful job. And they're sitting there, and the moment you tell them, now relax, close your eyes, and they look at you like you've lost it, you know? And so this is everywhere. The difficulty of voluntarily, that means they need to cooperate with us to be ready to say, I'm ready to let go and go there. So how is, I like what you said, how do we go there without them realizing of a state? is what the WHO describes as a state of unease or a disease. You feel not okay. There is an experience, a feeling of not okay that starts before anything else. After that not okay comes the car driving on the right side, horning, trying to overtake you, and then you say, "What the hell are you doing? Can't you see that I'm on the right side of the road and you're on the wrong side of the road?" And then a minute later, when somebody asks you, "Why are you so agitated?" you say, "Did you see that man on the right side? How he crossed in front of me?" But if you go backwards, you would see that it was a few minutes or hours or time before that you already didn't feel okay. That is why that man on the right side bothered you. I recognize this because there are days when I will enter my house and I will say, "Oh, look at the way the shoes are kept." And I will go and pick all the books and put them away. And my children will say, "Did you have a bad day at work?" And then I recognize I didn't really have a bad day at work. And then I'd say, "Can't you see you left all your bags lying all over the house? I enter the door and there's a bag lying right in front of me. What do you expect? Do you think I'm going to be in a good mood?" And then my son says, "Yeah, but the bag was there yesterday also. And yesterday you came and hugged me." Do you get it? So the bag was not the cause. The man going ahead of me was not the cause. It was something that started when I was driving up, which had nothing to do with anybody or anything. There is no explanation. It's just there. Malcolm Gladwell, from the book The Blink, says that, that we as human beings have a story problem. He says in the book that we try to find explanations for everything, even if there are no explanations. And thus we build a story around what is happening to us. So there comes that experience, that state. We quickly fill it in with a reason from the environment, and we forget. We lose touch in that split moment of where it all starts. We're totally immersed in the story of this man that has overtaken us. And then we are indignant. We're totally immersed within our emotions of agitation, insult, thoughts of what you are going to do in this corrupt world where nobody follows any rules, and how you're going to go on a fast unto death, and what are the steps you will take, and how you will punch him on the nose the next time you meet him. And we get so immersed with it that we completely forget that it all started before any of this. There was that feeling within of unease, our state. And then quickly we tried to find reasons to fill that state, to fill that vacuum of not knowing why it is there. We're trained to believe and follow cause-effect. We like cause-effect. That's a problem, right? So therefore, world over, in fields of science, people have had difficulty accepting neophysics, have had difficulty moving from classical science to quantum science. Because classical believes in this is cause, this is effect. Quantum says, we don't know why it happens. It's all happening anyway. And we don't like it. Einstein, who started this whole concept, couldn't accept it. He lived his entire life fighting against the very door he opened. Because he couldn't give up that idea that this is caused by this, that it could have all just been without a cause. As homeopaths, we have to let go of this trying to find the cause in the environment. It's only when we let go of that cause in the environment can we take the patient to that state which has nothing to do with the environment. What I'm saying is, theoretically, intellectually, we all recognize that state has nothing to do with the world around. Yes, we know this. But yet when it comes to our own lives, or when it comes to our taking of the case, we are not able to let go of this. And therefore we say the patient is not going into his state. More often than not, it is we who are unable to let go. And how will the patient move there? We are holding him into his story. We are holding him to the incidents around. We are holding him into the emotions. How will he go beyond that? And therefore, it's very important for us at every point to recognize this is merely a story. This is merely the emotion. This is merely the reaction. This is the thought I have about my state. And beyond this all is the state. So to answer your question, the definitive ways of taking the patient to his state is first to clearly for ourselves recognize what are the different things that are in front of us when a patient speaks. So he tells you, I have a knee pain. And you say, tell me, what do you feel about this knee pain? And he says, I feel crippled because of the knee pain. What is this? Is this his state? Could you answer that? No. That's the result of the knee pain. The result of the knee pain in his life has hampered his movements and therefore made him a cripple. Right? So this is not his experience or the state. This is merely an outer result of it. Then you ask him, and what's happening? I can't move. I just cannot move. Is this his state? Is this where it all started from? No. Again, it is the consequence of it on his life. I am so depressed. I have become a bedridden person. There is no point in living. I want to kill myself. Is this the experience or the state where it all started from? No. This is the result of the end of it where he can't move and so he's feeling depressed and that's his emotion. Can you understand? And yet, so far, until 2-3 years ago, this is where we would stay at. We would go to the emotion and to see where or how he is reacting to his knee pain. Take that to a delusion level and prescribe. Was it wrong? No. We had wonderful results with that method because you also recognize that every patient and every remedy will pick a particular group of emotions to throw out his problem into. Do you understand? So if calcarea carb has an experience, he will pick a certain group of emotions to show you. He will pick a certain group of thoughts to show you. He will pick a certain group of reactions to tell you, which will be different from what a natramure will show you. Yes? And so that method works as well. Worked as well, and we had lovely cases and good results with that. So what happened? The problem with that is that there were a good number of failures as well. And it is those failures that led us to see how can we fine-tune this even further to cut down on the failures. And then you realize that if something starts at a point A, and then it can have 5 emotions, it can have 5 intellectual reactions, it can have 5 effects on one's life, and you can use any of these to prescribe. You're never sure if it's only 5. It could be 7, for example. Do you understand? One of those emotions can overlap with another remedy, and then we can get confused. As we move into a wider spectrum, the chances of making error get more. So when you move from where it all starts to the state, into the emotion, the error chances are a little more. You go to a story, the error becomes more. You go to the outer symptoms alone, all the rubrics of the case, just the external manifestations, you move to a wider area, again the chances of error are more. Does it mean that this is wrong? No, it isn't. Does it mean that emotion is wrong? No, it isn't. It just means that the human error can be more, both from the side of the patient giving you the peculiar symptoms and from you taking the peculiar symptoms. But when you go to where it all starts, that experience, that state, it's a small area. It's very narrow. It's defined. It has it doesn't have overlaps with other remedies. The chances of error become much less. And therefore, the change or the movement from moving from a rubric or an emotion and delusion into this area of sensation or experience or that state from where it all starts. Is that clear? Yes? To help the patient get there, what do we need to do? Because this is how we will talk. If you go back to the time when you gave your case, understanding everything, you would also say, I have a knee pain, I can't move. It's a pain. And then you say, describe the kind of pain. And the patient says, how many types of pains are there? You give me examples of types of pain. Pain is pain. Then you have patients who tell you, as you ask them, tell me more. Tell me more about the pain. I wish I had a thesaurus, so I could look up different words to describe pain. Do you understand? And then you have patients who tell you, what are you looking for, doctor? Do you understand? How do we help them? The simple solution to this is, as the patient speaks and you say, I'm having a pain in my knee. And he says, I'm feeling crippled. And you say, yes, but that is the result of the pain. It all starts from the pain. So can you go back to the point where it starts and tell me what is it you feel in the knee that results in your feeling like a cripple? What happens there is you clearly defined for them that there is something that is a reaction and something that is an experience. And when they can see the two clearly apart, they can move to the next area. Do you understand? At the same time, we say yes, because the moment we tell a patient, no, that's not what I'm looking for, there's a good chance they're going to block us. This is human nature. So the moment a patient feels that he's not giving you what he wants, he can either get defensive or offensive. And neither of them will help you to get to the experience. They will block you. I read about a way of drama or theatre which is done in England. And that theatre, I forget what it's called, but the entire theatre is it's extempore. So a 2-hour theatre is performed without a script, without characters being defined, without anybody knowing any central theme of the story. It just evolves within 2 hours as an interaction as one speaks to the other. But they spend 6 months practicing for this. Now the question is, what do you practice 6 months for something that has no script, has no story, has no characters? What are you doing? The only thing they're doing is how to keep communication open, how not to stop a channel of communication. And the key element there is never say no. So for example, I still remember the example in that which says that if a person is said, I'm the doctor and I tell the patient, you have gangrene and you need your leg amputated. And the patient says, no, I will not get my leg amputated. The script finishes. There is nothing anybody has to say and it totally stops. So the training is that the other person has to say, yes, but I don't really want to get my leg amputated. Is there an alternative? Do you understand? This keeps the communication going. And that's what we do with our patients. Yes, but this is a reaction. Yes, but this is an emotion. Yes, this is what you're thinking about your problem. Yes, this is the consequence of it on your life. That's great. But where is it all starting from? What's happening in the knee from where it all originates? Can you understand? This clearly differentiates for them the difference between state, emotion, intellect, reaction, and the effect it has on our lives.